I'm the Director of Communications here at United Health Centers. We're here today to recognize Medicaid Day of Action, a vital moment to highlight the importance of access to care in our communities. Joining us today are Congressman Jim Costa, our President and CEO, Justin Priest, and our Associate Medical Director, Dr. Shaba. Let's begin with Congressman Costa, and please welcome him to the stage.
Good morning. Good morning.
Good morning.
Nice to hear smiling faces. Today, I have asked our friends who share a common passion, and that is to ensure that we have the best accessible and most affordable health care for people here in our valley and of course people throughout the country. And we are attempting throughout the country to, among my colleagues, really focus on Medicaid, a day of action. Medicaid, a day of action. And I want to thank members of the press for being here. You're responsive and you're always trying to make sure that our communities are informed, and your purpose and your place here this morning is doing just that. Because health care to the people, my mom used to say, and some of you have heard me say this, that if you don't have health, you don't have anything. And I think that when you talk to folks, when I talk to my constituents, they're concerned about a lot of things that's going on in our communities and with their lives and their families. And they're concerned about what Washington's doing with will impact access to health care for everyone in our valley, not just those on Medicaid. And I want to thank United Health Centers for making their facility available this morning to give you an opportunity to hear from them and to ask questions to all of us as to literally and figuratively what happens when these cuts occur to people back home. And I'm glad to see a part of the hardworking staff members from United Healthcare as well, because it impacts the ability for them to do what they care so much about, and that is helping people with their health. And you can see the flow of folks coming in here to the clinic today. But this is across the country, it's across our valley. 2 days ago was in Reedley, at the hospital facility there with Advantage Healthcare, and we talked at great length about the impacts that they think it's going to include to their health network system throughout California and the cuts that they may have to make. And they have hospitals in Reedley and Selma and Hanford. So this is Medicaid Day of Action, but it really impacts all of our healthcare facilities, our hospitals and our healthcare clinics throughout our valley and throughout our country. Let me give you some facts, and then I'll let Justin make comments that he believes are relative to United Healthcare Centers. As you know, earlier in the last month, we passed the big something. I didn't think it was beautiful, and therefore I did not vote for it. And I think there's a case to be made when you look at $1 trillion cuts in Medicaid and Medicare for our affordable health care system, our safety net, and the additional cuts that were taking place in nutrition in terms of SNAP, and the impacts to a lot of people who are food insecure. And I'll give you some statistics here, but when you make this case and you look at the totality of this legislation, I think an apt description for many of us is a one big ugly bill. This is the largest cut to Medicaid in U.S. history. 70% of the cuts are for the purpose of extending the tax cuts to the very wealthiest people in America. But let's talk about our valley. We love our valley. And when you look at the 5 congressional of West Virginia, so think about it, the 5 congressional districts combined. In my district, my congressional district, we estimate that 456,532 people that rely on Medicaid will be impacted. That's over half of my constituency. Fresno County, and some of you know this, has the 3rd highest enrollment rate of all the 58 California counties. Fresno County has the 3rd highest enrollment rate for Medicaid. And so these cuts potentially could result in over 247,384 people that in our valley would be without health care. Let me give you a juxtaposed to that. In 2010, when we passed the Affordable Health Care Act, 24% of my constituency then had no health care insurance whatsoever. 17% were underinsured. 10 years later plus, that number went from 24% without any health care insurance to 10%, and the underinsured improved significantly. So what's this mean to our hospitals? We're here at Community Medical Center, off the campus of Community Medical Center. And I think it's important for members of the press to remind your viewers, Community Medical Center is the 2nd largest hospital in California. 2nd largest hospital in California, with over 1,200 beds and 3 campuses. It has 60% of its, over 50% of its patients are on Medicare. Valley Children's has 75% of its patients, or 3/4, who rely on Medi-Cal as their primary source of insurance. Cahuilla Delta, that I represent in Tulare County, it's almost 40%, 39.5% of their patients. So what's at stake? A lot. That's what's at stake. Medicaid payments to hospitals will be reduced over the period of time, $665 billion. $665 billion will be the reduction. On the average, rural hospitals, and we're in part of rural America here in our valley, estimated will lose 21 cents out of every dollar they receive from Medicaid funding. So even if you're not on Medicaid or Medi-Cal, and you have your own separate insurance, you're going to find the impacts, because these healthcare facilities and our clinics are going to try to figure out how they can continue to provide their level of health care with less money. And so it's going to impact. It could result in reduction of staff. It could result in longer emergency room and wait times. Let me give you another factoid. I was just there 3 weeks ago with a family member, but Community Medical Center has the highest utilization of emergency room use of any hospital in California, and 9th highest in the country, such that on any given day, and you can go over and see it, I'm sure you can check with the hospital, they will assist you, 150 to 200 patients are in hospital beds in the hallways. Think about that, because there's no place, no beds to put them. They're in hospital beds in the hallways, 150 to 200 a day. And clearly that's a real impact. And higher premiums, because healthcare business, which occupies about 22% of America's GDP. Think about that. Healthcare costs in America account for about 22% of our GDP. But they're having to make adjustments now, and while the cuts won't take place until 2026, United Health Centers can't wait until 2026 to begin making adjustments. As I met with Adventist Healthcare in Reedley earlier this week, as we were setting up a workshop in August to meet with all the hospital facilities here in the district and the clinics, as they do their own deep dive to determine what changes they're going to have to make in terms of access to care and the quality of the care. So when they talk about the $50 billion that the Senate ended up putting out there for rural hospitals, well, that's helpful. It's temporary. And it doesn't meet the value for rural clinics and the definition of rural clinics in America. It's estimated that rural clinics and hospitals here in our valley and throughout the country under that definition will be impacted somewhere between 150 and $200 billion. So $50 billion, excuse me, does not cover the impacts of rural health care nationwide. So this is what we're dealing with. And so rural clinics, and I'll close on this point, like United Health Centers, have done so much for so many. And the other clinics that we have here in the valley, whether they be, you see them all around, besides United Health, does a terrific job. You have Clinica Sierra, you have Golden Valley, you have Carmelita, you have a whole host of centers. And when we passed the Affordable Health Care Act in 2010, and I noted this earlier, what a lot of people don't realize is that there were $8 billion in that package for federally qualified health care clinics in America. And so what you've seen here in our valley, like United Health Centers, is they've all expanded and they've provided more accessibility to our rural areas. And that's critical. I mean, you think about it, you know, if you live out in Mendota, or you live out in Orange Cove, or you live in any of our communities, if you have a healthcare situation, I mean, it's a long drive to Fresno. It's a long drive to Visalia. And so our clinics and the expansion that they've done, and let me applaud them over the last 15 years, have really filled a gap and made a big difference to access to health care. So this is where we are. Medicaid Day of Action is appropriate that we notify Americans of the impacts that this piece of legislation, this one big ugly bill, that's just the reality. And let me introduce a person who I have the pleasure to work with, and his team and their board of directors who do an excellent job with the United Healthcare Centers, the CEO of United Health, Justin Perez. Justin, please come.
Good morning. Welcome to downtown Fresno. Before making any comments about everything, I first and foremost, I want to thank our congressman. He has been nothing short of just a fierce supporter of healthcare in the valley. And he was an integral part of us being able to open up the clinics here in downtown Fresno, getting through the administrative process with our federal partners. And so I want to thank him so much for that, because what we have here today, he has been a huge part of that. So thank you. I could say ditto to everything that Jim just said, because he always does such a wonderful job of really talking about the landscape and what we're dealing with. But it really starts to hit home here with us. And as I speak to you about this, I have a lot of passion for this because I'm born and raised here in this valley. And our communities really deserve access to the care that they need. This shouldn't be contingent upon income, zip code, immigration status. Everyone deserves to be healthy. At United Health Centers, we proudly serve over 180,000 patients here in the Valley. We have 35 health centers and we're growing. We have 4 other health centers opening before the end of this year. So as Jim talked a lot about growth, we're continuing to grow because people need it, shortages, and we have a very limited healthcare infrastructure. So any cuts to the Medicaid program, it's devastating. I can tell you we're already trying to do a lot with not enough. almost 70% of our patients here are on the Medi-Cal program. If this safety net is weakened, the things that many of us take advantage of every day, simple things such as prenatal care, cancer screenings, pediatric visits, life-saving medications, those things can go away for many of our patients. Without, and as Jim also talked about, without the Medi-Cal program being available to many of our patients, our emergency room is going to become even further overburdened and overwhelmed. And I want to mention that it's not just overburdened and overwhelmed for people that just don't qualify for Medi-Cal. It's for people that have private insurance. It's for everybody. We all are going to have to wait longer and not have access to what we need. I can think of so many stories from our team, and many of them are here today, and I really am happy they're here and have done so much to get the clinics down here set up. And I'll let Dr. Shabafers talk a little bit about how this impacts what she sees every day in clinic, seeing patients every day. And that's really where it hits home. This bill targets Medi-Cal and patients and jeopardizes patients here in the Valley. With over $1 trillion in healthcare cuts, we're talking about less doctors, less places to take care of patients, and less programs. Just simply comes down to that. Cuts to Medicaid endanger real people. You know, we talk about groups of people that are out there. What happens with our farm worker patients? What happens with this? These are people. These are just people like me and you that need to be healthy and safe. And we need to protect public health, their economic stability, and most importantly, human dignity. So here's the call to action that we're talking about today. I'm urging our elected officials, and especially those like Jim that represent our communities here, to protect Medicaid and the health and well-being of our communities. We call on our community members also to stay informed, speak up, and support health care for everybody in this country. Thank you. I'll turn it over to Dr. Shabafers to talk a little bit more about what she sees here at United Health Centers. Thank you.
Good morning. So, as Associate Medical Director of United Health Centers, I have the privilege and the responsibility of ensuring our clinical teams provide high quality care to thousands of patients and families in our community. Today, I speak not only as a physician, but as a real life witness to the impact Medicaid has on public health. Medicaid is more than just insurance. It is a lifeline that allows us to diagnose, treat, and prevent disease. More than half of our patients are enrolled in Medi-Cal. These are parents, children, agricultural workers, and seniors who would otherwise go without care. When patients delay care because they can't afford it, their conditions worsen, and ultimately it costs the health systems more, and this will impact all of us. Often we see in the Central Valley kids with asthma exacerbations. Medicaid is what helps families afford these inhalers and medications that keep kids out of the hospital. And this is what's at threat with the cuts to Medicaid. If Medicaid funding is cut, we will see a rise in preventable ER visits, untreated chronic disease, a rise in preventable cancers through early detection programs, and overall worse outcomes in our patients and in the community. This especially impacts rural communities like the ones we serve. This isn't a theoretical threat. These are real clinical consequences with long-term effects. As a physician, I can't stand by while access to care is being threatened, and I know my colleagues across the state feel the same. We call on policymakers to strengthen, not weaken Medicaid. This is not just a budget item, this is the backbone of community health. United Health Centers will continue advocating for our patients, and we will continue caring no matter the challenges, but we need Medicaid to stay strong. Thank you.
All right, we'll take some questions this time by members of the press, but let me once again thank Justin for his passion and his team at United Healthcare Centers to make healthcare accessible to all in the valley. And let me underline the doctor's comments, because I think they're key to what we're dealing with here. You know, our families, many of us grew up learning that an ounce of prevention is worth a pound of cure, right? These clinics provide preventative health care so that people, when they, you know, are feeling, you know, poorly, they can get in, they can get access before whatever ails them exacerbates to a point where they then do have to be in the emergency room because they were not able to take care of it earlier. And so this is why it's so important and why Medicaid Day is critical that we highlight this to all. So with that, we'll take questions, but thank you, Doc. And, you know, and Justin, part of our challenges here is we're an underserved area. We have a shortage of physicians and we have a shortage of nurses. And we're trying to remedy that by increasing our capacity to provide more schooling and for those planning to become a nurse or to become a physician. In this effort to put a full-fledged medical school here in the Valley is part of that strategy, working with our community colleges and Fresno State that all have nursing programs to expand that effort as well. And that's obviously related to this because CMS provides slots for facilities for medical schools, and that's one of the efforts that we're working on. So we'll take any questions that you might have at this point in time.
Congressman, Republicans said that you are prioritizing taxpayer-funded benefit for illegal immigrants or Belize Californians by voting against the bill. What do you say about that? What's your response?
Well, Republicans don't know what they're talking about at that point. I'll start there, okay? The fact is that healthcare is critical for not only every Californian, but for every American. And so a society is judged upon how we treat one another. And if they're talking about people here that are undocumented, people that are working in our agriculture community, in our hospitality industry, in construction, some of the hardest working people you'll ever meet in your lives. I will tell you that people in agriculture in this valley want their employees to have access to health care. Wouldn't you think so? You ask any of the major employers here in the valley that employ farm workers, and what are they going to tell you? We want our farm workers to have access to health care. So my statement stands. Have those Republicans come here into the valley and tell our farmers, our ranchers, and our dairymen that no, we don't want you to give health care to these people because they're not documented, because we think that's just the right thing to do, but they can go ahead and still work. Give me a break.
And of the stats you give of how many people in your district are on Medicare or Medi-Cal, how many are undocumented?
I don't know that number, but another number I can give you is that 70% of the agricultural workforce is estimated here in California to be undocumented. So, you know, you extrapolate that number among the 5 congressional districts, I suspect that number would be fairly consistent, but I don't have an exact number. But does that allow you to get a sense of a large percentage of people working in agriculture that are...
Well, that seems to be the crux of Republicans' arguments, that a with legal blueprints on,
Well, then they should join in the bipartisan comprehensive farm worker modernization act that does have bipartisan support. And we could fix this broken immigration system instead of pontificating and politicizing this issue. How's that, Dave?
your response.
Good.
Congressman, with the spending bill already passed, what steps are you and your colleagues intending to take at the Capitol to protect Medicare and Medicaid funding?
Well, we're going to have to continue to make our voices heard. That's what we're doing today. And on October 1st, we have to have a budget passed. And one of three things will happen. We'll either have an omnibus package, which I think is unlikely. More likely is a continuing resolution. And whether that maintains government funding at the current level for another period of months or to the end of the year, I cannot predict. Those determinations will be made in September. And in a worst case scenario, and I hope it does not happen, we could have a government shutdown on October 1. So that's what's coming as we are working our district, and I'm meeting with constituents, and I'm meeting with agricultural leaders and employers and people in business to determine what their view and what their concerns are about this effort to impact a large part of our working force. The president says that he loves farmers. I believe he does. But when he goes after an incredible amount of hardworking people who are fearful of even going to work at this point in time because of the efforts with ICE up and down the valley and throughout the country. So we will continue to raise these issues and use the budget process to see if we can fill in gaps. I mean, Senator Josh Hawley from Missouri, who voted for the measure, has now introduced legislation that would try to fill in some of the gaps that are created as a result of the passage of the bill. So how many other members of the Senate and the House feel that way? I cannot tell you at this point in time.
Congressman,
Hold on, let me make sure that you do a good job, David, and I want to make sure your questions get answered, but I want to make sure everybody else has a chance to. Yes?
Now that the bill has passed, what can do people who's gonna be impacted by this do in the meantime?
Could you repeat that, please, one more time?
Of course. Now that the bill has passed, what can do people who's gonna be impacted by it directly can do in the meantime?
Well, the people that are going to be impacted, as I tried to explain, are those that are reliant on Medicaid for their safety net, for their primary source of health care. And the numbers are staggering. I gave you those numbers earlier. But they're in the 5 congressional districts can be as much as 1.8 million people. And Valley Children's Hospital, which is one of only 5 children's hospitals in California, has about 75% of their patients rely on Medicaid. And 50% of the patients and over 50% in community regional medical center, the CMC. Almost 40% of the patients at COEA. So these are all hardworking people for the most part. Some are elderly, some are people with disabilities, some are children that are going to be impacted. And yes, a significant number of those are undocumented.
You mentioned the time frame of some of the negative impacts in the year 2027. Is that when the majority of those impacts is going to happen, or are the impacts happening right now?
I'm going throughout my district meeting with all of the major healthcare providers in the month of August, and I'm asking them to do a deep dive in terms of how they believe it's going to impact their ability to provide healthcare, which is their mission of our clinics and our hospitals. But let me have Justin respond, because what I'm finding is that as I talk and have these conversations, that the healthcare providers are trying to anticipate what the impacts of these cuts are going to be in the next year and in the next 18 months. And my sense is, in my conversations, is they can't wait for a year from now or 18 months from now to make a decision. And so while there's going to be a ripple effect in terms of people feeling the impacts of those cuts as a result of changes that they are going to be making with their staff and with their boards, they got to be making determinations at this point. And that's why we're holding this workshop later in August. But Justin, do you want to respond to that?
Yeah, no, I think it's exactly what Congressman's saying. I mean, we're all trying to, I spent hours sitting down and trying to figure out, you know, what's the exact impact going to be. And there's some unknowns in this, but we all can easily say that there's going to be some significant changes in the amount of insured people that we're able to take care of. So what happens? Those patients become uninsured, and we still have to take care of them. So now we're taking care of patients without insurance that we're really not receiving reimbursement for, because that is our mission, is to take care of everybody that comes through our doors, regardless of if they can pay or not, or if they have insurance. I've gotten a lot of questions about this over the last few months, and so what does it impact? As I stated earlier, we're already trying to do more with less right now. If you look at community health centers, we do so much more than just, you know, a doctor visit. There's so many of these other things that we provide that become very challenging to continue to provide. Enabling services is one of those things. Things like, you know, we have a free transportation program. We have case management services. We do all these different things, and we want to continue to do these things because it's important for our communities. But how do you continue to do them if your revenue is drastically slashed? And so that's what we're trying to anticipate and put together a good plan of what we're going to be doing in the next year.
Additional questions?
What actionable steps can people here in Central California take if they have concerns about the funding or access to Medicaid and Medicare?
Well, a couple things. First of all, and having been the primary caregiver for my mom when she was still around, you know, you have to figure out for your family what kind of level of care you will still have accessible to your loved ones, whether it's here with United Health Centers or other places in which you may receive your care. If Medicaid is your safety net, then you have to look and examine what your alternatives might be. On my level, my focus and goal is to try to work with my colleagues on a bipartisan basis. Many of them know this is going to be harmful to them. You know, to your comment earlier, David, this is a lot of rural America. It's a lot of, in political terms, red America that are going to be impacted by these cuts. And my colleagues who represent those areas know that. And they're trying to deal with it. That's what the $50 billion was not enough. Maybe it will address a quarter of the needs. It's the reason why Holly's reintroduced this other piece of legislation, because they believe that their folks are going to be impacted and hurt. So hopefully we can use that as an opportunity to develop some bipartisan effort to fill in the gaps, either with the budget coming due on October 1st or other means that might become available in which my colleagues might try to address it on my end. So what you can tell your viewers is obviously they need to assess and determine their own vulnerabilities as it relates to their safety net and how they rely on what form of insurance, whether it's Medicaid, Medi-Cal, or whether they have another means of insurance. But the other thing that Justin talked about is that, and it gets to, again, to that question, a society is judged upon how you want to treat those who are most vulnerable. I mean, when a person is sick or a person is in an accident, we don't leave them on the side of the road, do we? So the bottom line is that we've created a problem here. And those of us who voted against it did so because we understood that this was a direct impact, the largest cut in U.S. history on Medicaid. In history. And you don't do something like that without having a significant impact on communities throughout our country and certainly in rural areas.
Costa, I just want to get your thoughts on Governor Newsom's plan to gerrymander congressional districts.
Let's answer that question later on. This is on healthcare. I'll be happy to, as I always do, take a moment with you to answer other questions that are not related to the subject matter at hand. You always have good questions. Any other questions as it relates to this issue? And I don't know, Doctor, if you'd like to, I mean, I see the passion that all of the physicians and nurses and medical techs that are represented here have every day. They come here, it's 24/7. It doesn't know when people get sick, when people are in an accident, this is a place they come. And the demands, I mean, as I related that 3 weeks ago when I was in the emergency room for about an hour and a half, I'm aware of that, but to again see it firsthand is just evidence of not only how hard you work, but the passion and the care and the literally triage, because that's what you're literally doing is triaging, making determinations on who are the most in need of your attention at the time. And if you want to make any other comments here, your experience is so valuable, and it's really what this is all about.
My biggest concern that I have right now is we are going to see a lot of the same shortages that we saw during the pandemic. It's going to constantly feel like the hospitals are overrun, the ER's overrun the same way it was over the last 5 years. So something to keep in mind. My message to the patients, my message to the community is do what you can right now to seek the care we can, and just keep in contact with your primary care doctors, because prevention is key to all this. Thank you.
All right. Justin, anything else? Thank you again, United Healthcare, for providing us this opportunity to be here. When we follow the end of this press availability, I'm going to sit down with United Healthcare staff, and we're going to get a bit of a tour of what goes on here in this clinic, but also sit down and have a deep conversation about what they're considering and how they're looking at addressing these cuts that will impact United Healthcare along with some of these throughout this valley. And I'll continue to be having meetings with all of the healthcare providers here in our valley for them to let me know firsthand how the impacts are going to hit home. And that's really my concern and why we're here today. So I'll let our person of accounts director close. You want to?
And that concludes our press conference, and thank you all again for being here today.